Well, hello and welcome. I'm Dr. J.P. Amonte, and in this video, I'm going to take you through the total body tune-up, the combination of chiropractic adjustments and soft tissue therapies. I'm also going to show you the elements of a comprehensive musculoskeletal exam that's designed to address the entire structure of the body. Let's check it out. As a chiropractor, I'm primarily looking at the spine. And so typically, when addressing the spine, looking at the neck and the cervical spine, there's 7 vertebrae. And as we look at the neck, we'll find there's different ways to correct or adjust the neck. Then the mid-back is in the thoracic spine. There's 12 vertebrae here that connect the ribs from the mid-back around to the front of the body that directly relate to how we breathe and the structure of the body. And then the lower back. In the lumbar spine, there's 5 vertebrae, and down to the sacrum, which forms the basis and the foundation for the spine relating to the hips and any lower back pain. Now, more than just the spine, we also want to check the legs and lower extremities. In my opinion, it's essential to address the feet, the toes, and the tarsal bones that make up the feet, along with the ankles, checking for flexibility and for good alignment of the feet. We also want to check the knees, make sure that not only the knees moving well in flexion and extension, but also the contact between the femur and the tibia is maintained in a proper alignment. We also want to check the hips. The hips move in a variety of different ranges. One of the most important aspects is rotation, as oftentimes the hip joints can get jammed up. And by correcting the feet, ankles, knees, and hips, this forms the foundation for the spine and the rest of the bones moving up the body. Now, as we move up the body, we also want to check the arms and the upper extremities. We're going to make sure that we address the shoulders. The glenohumeral joint has the most range of motion in the body, so it's susceptible to dislocation, and making sure it's properly aligned will keep good function and range of motion in the shoulder. Now from there, we're also going to check the elbows, both in flexion, extension, and also in rotation, as well as checking the wrists and the carpal bones, along with the fingers, all the way out to the tips of the fingers, it's known as the phalanges. Now, once we've aligned the central bones of the body, we're also going to check the abdominal organs, along with checking the TMJ in the jaw, face, and the cranial bones as well. Now, once we've created the alignment and the manipulation, and throughout the treatment, we're going to be integrating soft tissue therapies. One of my favorites is myofascial release, using simple movements of skin rolling, along with opening the connective tissue and releasing any stuck or tight areas. We're also going to address the muscles through neuromuscular and trigger point release by identifying the tender areas and the specific muscle spasms by using simple vibration and breath work. These can be released and relief off of the pain in the surrounding nerves. Incorporating stretching. The type of stretching I like to use is PNF clinical stretching, along with integrative massage therapy techniques. One of my favorite types of massage to always finish a total body tune-up is working along the spine. Once we've corrected the spinal alignment and taken pressure off the nerves, we want to coordinate along the central nervous system, and this will promote deep relaxation and help the nerves to function at their best, affecting every organ, every tissue, and every cell of the body. So I use a PARTS method, and PARTS stands for pain, asymmetry, range of motion, tissues, and then looking at any special tests to rule things in or rule things out. Now, this video is not intended to diagnose or treat any conditions, but give you a good overview and things that can be combined together to work effectively for the whole body. So let's go through the PARTS method. First and foremost, addressing the person's pain or any areas of discomfort. First, looking at when it began and what was the person doing. How has it progressed? What are the things that make it feel better and what things make it feel worse? Then looking at, is this pain traveling and how would you describe it? And then the frequency of when it happens. How often, how long does it last for, and more importantly, how intense does it get on a scale of 1 to 10? Just by looking at these elements will give you a good idea of what tissue is involved and how we can go about best treating it. So when looking at the symmetry of the body, we're essentially doing postural analysis. Now you want to do postural analysis in multiple different views, meaning look at the body when the standing position, look at the body in the seated position, as well as face up and face down. By looking at the frame of the skeletal structure will give you visual clues about things that can be off or imbalanced. Next is range of motion. Now we want to look at how the body moves. And with every physical body, we exist in 3 dimensions. So we want to look how it moves forward to backwards, side to side, as well as turning and rotating. Now with range of motion, there's different forms here. The first of which is active range of motion. That is, when the person's just simply moving the body part on their own. So we want to first find out what movements either cause pain and then what movements actually feel good and help make discomfort go away. Now, passive range of motion is when we're relaxed and the practitioner or doctor is moving the body part and the joint through that range of motion. Now, because passive range of motion, the person is relaxed, we've relaxed the muscles and the tendons, and we're mostly going to be assessing the joint capsules and the ligaments. And the last one is resisted range of motion. And this is when the person applies resistance against us trying to create the motion in the body. Now, because we're resisting, no motion's occurring at the joint, and it helps to clearly identify what muscles or tendons are involved in the person's pain complaint. Now, the next part of a comprehensive exam is addressing and feeling all the tissues of the body. So by using our hands and palpating the different tissues and structures, we can feel the tone, texture, and temperature in actually what's going on and how the tissue responds to touch and different forms of pressures. And lastly, in the parts method are special tests. Now, special tests can be comprised of orthopedic tests, neurological tests, as well as muscle tests. And this will assess not only the sensory branches of the nerves, but also the motor branches to rule in or rule out specific conditions. And if need be, we'll then refer the patient out for further tests such as x-rays, MRIs, or other scans to identify any other underlying conditions. So that's a total body tune-up, and as you can see, it's a full body holistic approach to health and wellness. And by integrating the alignment of the skeletal system along with addressing all the soft tissues of the body between the muscles, tendons, ligaments, and joint capsules, even all the organs and glands, it is a total body tune-up. So if you're in town in Virginia Beach, Virginia, you can book a session at hhcare.org. You can also find more holistic health information, including videos, research articles, and the podcast, The Holistic Way with Dr. A, the website as well. Thank you very much. Check out our other videos. We are through for the present.